Check is proudly brought to you by First Capital Bank. Belief comes first.
All right. Good morning, Dr. B.
Good morning. You sound very chirpy today.
You know what? I have to try, Dr. B. It's been a couple of wild days. How are you this morning?
I can't complain. I believe rain's on the way, so I'm really chuffed.
I'm so excited too. All right. So I did let them know that we're going to be covering post-COVID, so let's take it away.
We sure are. And I think, now that the masks are down and we're not distancing as much, and it's almost like there's an amnesia, forgetfulness about what happened in the last 2.5 years.
Yeah.
I wanted to just summarize the sort of things that we've learned, and I thought this part of the episode should be the impact of the COVID-19 pandemic on the kids, and what we've learned about that in terms of what the impact has been on them, because they still are confused about what happened. And of course, they were the ones that were least affected by the infection itself. But, believe it or not, Zoo, most kids overcome COVID just like flu. But we're seeing some of the consequences of the things that we did to ourselves in the last 2.5 years. I'm talking about the lockdowns, the shutdowns, the lack of schooling, and particularly in my practice, where I see not very young children, but sort of teenagers and adolescents that come with other cardiac conditions. We actually talk to them about what the effects have been, and and talking to some of my colleagues, it's been a major thing, Zoo. We all know, those of us who are old enough to have had teenager children, that the teenage brain is something entirely different to the adult brain. We all know, we've all been through it, where the teenagers want to explore, they love danger, they love doing things that they shouldn't be doing. It's a developmental period where the brain centers are still maturing. There's an imbalance in terms of emotion. We've all been there. Attention, concentration, focus, emotion regulation, learning and memory. All these things are changing during the adolescent time, and this is what actually we found talking to clinical psychologists that has been affected during the lockdown. So, just to put you in space, we, as part of the rest of Africa, have a very young population. It's estimated that probably between 30 to 35% of our population are between the ages of 10 and 21. So that's a big adolescent population. So it really has impacted. And what's happened in terms of the developmental tasks that were disrupted, Zoo, are things that occurred during lockdown, failing to adjust to a maturing body and feeling, renegotiating relationships with adults, taking mature roles. A lot of kids had people, unfortunately, that died in their family, so they had to take on, a lot
of grief, and
absolutely, loss of identity, because they didn't have people that they could. They form, we as teenagers, as you and I used to be, form, relationships and with close friends, and tend to take all our, attitudes and our
stresses and whatever.
Absolutely. So all that went down the window, and of course then, the skills, coping skills, autonomy, morals and values. We learn more from our friends than actually from our parents. Believe it or not, we've all been there. And so this uncertainty that we've seen in children, so we've seen more of a mental post-COVID issue in our teenagers, where the uncertainty that occurred in the last 2.5 years, besides the economic hardship that affected their parents or whoever was the caregiver, there was boredom, there was no graduation, there was loss of loved ones, there was,
no interpersonal relationships.
Absolutely. And all of that has resulted in trauma, physical, mental, emotional. And of course, never mind the fact that, when people are alone for a long period of time, there was also a rise, as we've documented, of substance abuse. There was a rise in domestic
abuse.
The social isolation, the no sport, the depression, the trauma, all this stuff actually has had an impact. And we don't have statistics yet, but the Americans have come out with some, and I'm sure we're no different. This statistic comes from Harvard Medical School in the U.S., and they estimate on average pre-COVID between 10 to 15% of children under the age of 18 experience some sort of mental disorder. They estimated from June last year the impact of COVID resulted in a almost 30% increase in all young people with mental disorder. And unfortunately, we have a health system where we, at present, understandably, are prioritizing physical needs, blood pressure and diabetes and all that sort of stuff. And we are neglecting the mental
side,
another one that's come out from University of Pennsylvania, but this is in adults. Over 40% of U.S. adults reported struggling with mental health in the last 24 months, and they're saying almost 30% were depressed. 35% were using some sort of substance abuse to get away from whether it's alcohol or tobacco.
Yeah,
and attempted suicide as well. So these are issues that we've recorded. And I spoke to a clinical psychology colleague of mine, and what she said to me was that in her experience the last 2 years, there's been certainly the kids that she's seen increased stress, anxiety, depression, cutting. If people don't know what cutting is, people actually were attempting suicide by cutting their wrists. And of course, one that I never thought about was that of smartphone addiction, because that was
I can believe that. Yes,
that was their only means of escape. So it was really important in terms of understanding, the poverty and the food insecurity, the learning that was disrupted, the access to healthcare, gender-based violence, adolescents who became more anxious. So these are very many of the issues that became prevalent, and we need to start to discuss them post-COVID.
Okay, Dr. B, I see like you're saying, there's a lot of mental issues that are arising and a lot of things that are happening. So what kind of medicines actually work to kind of combat any of these post-COVID, I don't know what to call them. They're not diseases. What do we call them?
Well, it's an interesting question, Zu, and unfortunately, we're still in the learning curve, and sadly, with social media, we have people who, espouse all sorts of rubbish and don't know the difference between a protein and a proton, and suddenly they become scientists, and they probably fail their science at primary school. So we've got lots of rubbish on social media, but it's getting back into routine, Zu. What we're trying to get the schools to do is to get them back into a regular routine, sport, social interaction, getting people out, playing, getting good sleep, because people's sleep patterns were disrupted. So there are a lot of things that we want to get back to normal. Diets, too. People ate a lot of junk food during the lockdown. So, sugar content, fast food, processed foods, all these things have affected your gut. People put on weight, never mind children and adults, all gained weight. And so getting back into a routine of sleep, appropriate exercise, good nutrition, and social interactions are the cornerstone. Of course, there are drug therapies for those that are really depressed. And of course, it has done, Zu, is those that have much more of a tendency to become psychotic or have mental disease in their genes. It actually became much more transparent during COVID, because COVID was a trigger for it to unleash what was underlying in terms of the genes. So these are things, and we, both Sabrana as well as up north, are struggling at Jubilee in terms of managing some of these conditions, because our resources are limited. For those that are out there, we've encouraged schools. I've just given a talk this weekend on COVID and children at the Learning Center. But we're trying to get teachers to understand that another issue that was really important, Zu, that I didn't realize, is that during the time that children were allowed to go to school and everybody was wearing masks, particularly at primary school, children at primary school were not able to actually gauge the impact or the emotional changes in the teacher's face. And so they didn't know whether they were good or bad, or whether, because it was all you did was see the eyes. And so that they are not able to interact properly once the mask is down.
Wow.
And we're seeing a lot of their social skills have been left behind during the last 2.5 years, during the critical time at primary school. So a lot of these issues, where people were talking behind a mask, children couldn't hear very well. Interaction, so you look at your face, the whole face, not just the eyes. So a lot of these things affected primary school children. So there's a whole host of stuff that we need to untangle and tease out in terms of managing children, adolescents, and teenagers post-COVID.
Exactly. And we just have a minute left, but I don't know. I don't know, because you've already covered everything. That's why I'm like, I don't know. What are the risks, obviously, like for adults? Because I know, like, we're focusing on the kids and the teens and the adolescents. But for us adults who I can definitely say that social media and, like you're saying, certain drugs or certain things that they're using, what kind of risks are we getting to?
The key with the adults, Zu, has been we've realized that those adults that did unfortunately succumb to COVID were those with underlying chronic disease. So it's actually nailed the coffin even further in terms of cutting out processed foods and sugars, making sure if you're diabetic, you control your sugars very well, you lose weight, you exercise, you control your blood pressure, you sleep well. Because we know those that were diabetic, those that have asthma, those that were obese were the ones that actually succumbed, unfortunately, to COVID. So it actually struck home another chord to say, look after yourself now, because COVID hasn't gone away, Zoo. It's just, in abeyance, and we see in North America and Europe, which are going through winter, the rise in their COVID as well as flu. So it may come back with a vengeance. So make sure you take time
Just taking care of yourself, yeah.
Absolutely, Zoo.
All right. Well, Dr. V, thank you so much. I can't wait to talk to you next week. Would you like to share what we're talking about, or are we making it a secret?
I've been snowed under by requests because they said to me that they've accused me of not remembering that this is Women's Month. And we're going to talk about breast cancer. Breast cancer awareness this month, and who gets it, why do they get it, how do you prevent it, how do you screen for it?
All right. Thank you, Dr. B. I always enjoy these chats with you. Can't wait for next Sunday.
Cool, Zoo. Take care.
Thank you. And that was Dr. Bhagat and I on Health Check with First Capital Bank and Yarn FM.
Health Check was proudly brought to you by First Capital Bank. Belief comes first.